When you think about IVF, you might think there's a greater chance of having twins, or triplets even, but things have changed over the years. Fertility specialists, or reproductive endocrinologists, overwhelmingly agree that an elective single embryo transfer is the safest option for a healthy pregnancy.
The Centers for Disease Control, who also regulates the IVF practices in America, and SART, both carefully state that one cycle should yield one baby. And that's the goal. In fact, our goal as clinicians is for one healthy baby at a time.
After the transfer is the wait to find out if the embryo implanted in the uterus. This is commonly known as the 2-week wait.
After the transfer, the nurse will then review any do's and don'ts and what to expect during your 2-week wait. You will be encouraged to continue all medications and a normal life at that time. About 9 days later, we do your blood work, and if you are pregnant, you will be 4 weeks pregnant.
Once the transfer has happened, implantation has to occur. Implantation occurs over the next couple of hours to days. Some patients have some bleeding or spotting when implantation occurs, and most patients feel nothing. In fact, this is the most common question I get from patients. Doc, I had my transfer, I feel nothing. And I always tell them the same thing. Great, because you shouldn't feel anything. You're not going to feel instantly nauseous. You're not going to feel instantly pregnant. You're not going to hear angels singing right away. You're not going to have bleeding right away. Everyone's a little bit different. But typically it takes about 9 days after a frozen embryo transfer of a blastocyst, that day 5, 6, 7 embryo, to confidently tell someone by blood work that they're pregnant.
Another big question we get is, should I take a urine pregnancy test? This is a personal choice. For me, I would say, let's wait until the morning of that 9 days, and it wouldn't hurt to take a urine pregnancy test because it almost could prepare you for good or bad news. Others like to take a test immediately following the transfer. It's a personal choice, but our protocol is 9 days, so we wouldn't check your blood work until 9 days regardless of a positive pregnancy test.